Well, we're well into springtime here in South Carolina. Summer is fast approaching. It's time for us to really focus on that largest organ of our body. Think about which one that might be. Hey, welcome to the HealthLinks podcast, presented by the HealthLinks family of services. I'm your host, DJ Thatcher. Our mission here is to engage in conversations about the medical and the wellness landscape of South Carolina so we're all better informed. So to give you a clue of what that largest organ is, well, we're coming to you from the offices of Charleston Dermatology. We're joined by board-certified dermatologist Dr. Roger Sullivan. Dr. Sullivan, welcome to the HealthLinks podcast.
Thank you for having me.
So the skin really is the largest organ in our body, even though a lot of people don't think about that.
That's right.
What does the skin really do for us? Kind of a broad-based question.
Sure. So, the skin's the one organ that is a little bit unique because it's the one that everyone's really comfortable with because
Sure.
you can see it. And however, it actually is truly an organ. If you think about your pancreas, it's an organ. Your liver, your brain, your heart, these are all organs and they have really important vital functions. So does the skin. But we really don't think about it that way. So one way to think about this is if you didn't have skin, we'd be in a real problem. So water is pretty critical to the normal functioning of our body. And one of the most important things the skin does is keep things that should be on the inside, like water and salt.
Okay.
And especially things that should stay outside. So a lot of infectious organisms and things like that.
Sure. Also helps with temperature regulation, all these other things. Is that right?
Does. Sure does. Yep.
So, hey, tell us a bit, Dr. Sullivan, about Charleston Dermatology and the services you provide.
Sure. So we started this practice about 10 years ago. We're coming up on our 10-year anniversary pretty soon. My two partners, Dr. Lee Yarbrough and Dr. Adam Sprito, he's our Mohs surgeon. And so we got together and we really wanted to build a practice that we would want to take our family to. So that was important to us to provide a full, well-rounded practice of the services that we would want ourselves. We are definitely a medically oriented practice. So in terms of providing healthcare to people that is skin related, but dermatology, people want to look good in their own skin. And
Sure.
we wanted to be able to provide cosmetic services to our patients. And sometimes you need things removed from your skin. So surgical treatments as well. So trying to provide a very full-rounded healthcare services that are obviously dermatology related.
Terrific. Well, you're doing something right. So as you see in the background here, hey, you are the recipient of the Best Dermatology Center, Best in Health Award recipient for this year. So congratulations on that.
Thank you very much.
What's behind all of that? And, what makes you, or at least the public thinks, hey, the best dermatology practice?
So it really comes down to just core fundamentals. Every decision that we make in terms of when we first started this practice and our staff and other providers that we've brought on over the years when we've grown, it really is about providing really good care to people. So our core philosophy is providing an extremely high standard of medical care, but in a setting that's really pleasant. And that's what we've worked really hard to do. And I think it's paid off.
Terrific. All right. Well, our focus now, of course, this is almost mid-May that we're shooting this. So people are outside more. We're thinking of outdoor activities, the beach, the pool, the golf course, and so forth. And so really this is a focus on preventive health. What can we do to best take care of our skin?
So the skin doesn't need a lot of help from us.
Okay.
It is an extremely good organ at doing its job. However, so there's things that we can sometimes do to harm our skin. So it's really a matter of basic precautions. And if you think about sun exposure, that's what we're all used to. And we all have a sense of that we should be protecting our skin, but we didn't always have that sense. So,
right.
And then much the same way that people used to smoke and thought that was a fairly healthy thing to do.
Right. At one time, it was seen as a health benefit. Yeah.
And over time, with science, and we clearly understood that was not healthy. So the skin's similar. In the 1980s, it was not standard practice to wear sunscreen. This was a new technology and a new development. But thanks to a lot of public education and people and patients reading and making themselves aware, we all know now that sun in terms of too much sun.
Yeah.
Too much ultraviolet radiation actually can cause harm to our skin, and we need to have some ways to protect our skin.
Okay.
So sun protection is not something that you need to always think about when you are just going to the beach.
Okay.
When we think about, oh, we're going to the beach, I should not forget my hat and sunscreen.
Mm-hmm.
But then when the next day you walk out on Sunday afternoon and you might need to fix something in the yard or plant a new flower bed, and we don't always think, and it's going to take you 5 minutes, we don't always think about sun protection. But the way that sun damage happens is it accumulates slowly over time.
Okay.
So every time you walk from your car on a hot July day across a long parking lot, from every time you go to your mailbox and you run into a neighbor and you chat for 20 minutes, all of that sun exposure over your entire life, it just accumulates.
Sure.
And accumulates and accumulates. And you can really see this in terms of when you examine people's skin closely that come from different areas of the country.
Oh.
So somebody that I'm meeting for the first time as a patient, and then I'm examining their skin closely, and they just don't have much sun damage that I can see visibly. And I always ask, where are you from?
Mm-hmm.
And they are Connecticut.
Okay.
And then sometimes people have accumulated quite a bit of sun exposure. You can see that. And oftentimes that answer is I'm from Southern Florida or
Right.
San Diego. So it really does happen, but it takes a very long period of time. So that's one type of sun exposure.
Okay.
This slow cook is one way
Interesting.
to describe that. But then there's a very different type of sun exposure, and it can be just as significant in terms of promoting skin cancer. So there are some patients where you look at their skin and I can't visibly see any sun damage at all.
Wow.
But eventually down the road, they may generate a skin cancer in that area of skin. That person likely has experienced a severe sunburn or 2 or 3 or 4 or 5, even in their childhood. There was one gentleman that I saw, and I'll never forget him. He was an older gentleman in his 80s. And I don't think the man ever wore shorts. I mean, his legs and feet were so perfectly pristine, not any sun damage on them at all. And at one point, I diagnosed a skin cancer on the top of his foot, which we don't see many skin cancers on the feet. But in his case, I was just really shocked. And I said to him, have you ever had a sunburn on your feet? And he said, no. And then his eyes lit up and he said, I'll be darned. And he remembered back 70 years earlier.
Oh my gosh.
When he was supposed to help his dad with some chore the next day, but he decided to go out fishing. And he had such a severe sunburn on his feet that he couldn't help his dad, and he got in a lot of trouble.
Wow.
And then 70 years later, there he developed a skin cancer.
Oh man, now I'm feeling kind of badly. I started my long healthcare career as a lifeguard, hung out at the pool and the lake and that sort of thing. And in those days, just like you said earlier, we didn't really use sunscreen. In fact, you got that initial sunburn and then it peeled off, and then you got nice golden brown for the rest of the summer and thought you were doing well. So, that's, I'm feeling guilty now. Yeah. Had a few of those sunburns over the years.
I mean, we all have, right?
Okay.
And it's not a matter of that one sunburn that you had that will, cause you a lot of harm, like in that one gentleman.
Sure.
It really is more the number of sunburns that you've had over your life. I think teeth are often a good analogy. Occasionally, we've all had that night where maybe we didn't floss. That's not as much of a concern as what do you do on a routine, regular basis over many, many, many years? That's typically what will drive risk.
I see. Well, yeah, we mentioned sunscreen a moment ago as well. I see a lot of people when they do go golfing or go to the beach and so forth. They're pretty good. They pull out a bottle of whatever and they put it on. Just driving here to your office today, I saw a construction crew outside, a work crew on the road. I wondered if those people ever put sunscreen on. I passed a building project, people up on a roof and up on, ladders and things. I wondered how many of those people put sunscreen on just as part of their job. I don't know if you see much in cancers of the neck or the face, people who are just exposed outside all the time. That's fairly common.
Oh, sure. It's very significant. So when you are, we all go to the beach and we protect ourselves typically, but when you have a profession where you are outside and you're accumulating massive amounts of UV exposure over a really long period of time, that's where you can really get into some serious problems. So we see that in farmers especially, that grew up in an age where no one knew sun protection was really that important. You can see it on physical exam for folks that work outdoors in terms of areas of their skin that are typically exposed when wearing clothing versus areas that are not. Everyone from truck drivers, where the left side of their face has seen significant sun damage as opposed to the right side of their face. We typically see more sun damage on people's left forearms because their car window, they might place their arm at their car window as opposed to the right. So you really see this play out both in terms of what you can see, but also where you find skin cancers and on which patients.
I see. I'm a big fan of the spray on, the kind of mist that goes on evenly all over. And the other person will go nameless, says, no, you should really use the tube that you pour out and you rub it all over you. It's much better. Which one, if either, is better?
So there's a lot of debate, not just in
households,
but even among the scientific community, dermatologists, in terms of sunscreen. There are two main types of sunscreen in terms of ingredients. We have physical blockers, which physically block the sun from damaging your skin. And then there are chemical blockers, which you actually absorb into your skin and help. You still might absorb that ultraviolet radiation, but those chemical blockers basically transform that or neutralize the sun exposure is a way to think about that. So then there's the vehicle that you put one of those ingredients into, whether it's a spray or a cream. So the key thing with sunscreen is whatever sunscreen you're more likely to use. So for many of my women patients, they wear makeup. And they want to wear a sunscreen that they can apply makeup afterwards. Or maybe it's a sunscreen that doesn't leave a thick white film on their face. My guy patients, getting them to put on anything is a win. So you might choose a sunscreen that's just easy and convenient. So that's usually my answer. Now, we talk about, well, how long is the sunscreen going to last? So if you are out golfing and sweating in tennis, or maybe you're going in and out of water exposure, there are some differences there. So the thicker a sunscreen is, the longer it's going to last on your skin before you have to reapply it, as a general rule. However, sunscreens, they don't last very long. Sunscreen is effective, but the problem with sunscreens, either from the very thick sunscreen that leaves that thick white paste to just a simple spray, is it will wear off. So if you go to the beach for, say, 6 hours, you have a nice long day at the beach, and you use a very thick sunscreen, or maybe the husband just sprays something on quickly. If you don't reapply, you're getting hours of unprotected sun exposure. So the key thing with sunscreens isn't necessarily which one to use, it's reapplying. You have to reapply. And reading the label on the sunscreen is appropriate because there are some differences there, though, in terms of the vehicle.
This advice goes for cloudy days as well. Is that correct? A lot of people think, hey, it's kind of overcast outside. I really don't need a sunscreen. Is that true, or? No, I've thought.
So, and I think most people, if you're thinking about it, if that cloudy day where you did have a lot of sun exposure, especially earlier in the year where we're not thinking as much about sun protection, and you surprisingly got sunburn. And that is just showing that ultraviolet radiation absolutely can penetrate even on an overcast day.
Now, what about the SPF? That's a sun protection factor. Another big debate in our household. I heard somewhere at some point, I don't know if it's true, that an SPF of 15 basically provides almost as much protection as an SPF of 50. I mean, they both block out like 90% of the rays. Maybe that was advertising I heard that wasn't true. I don't know. What's the truth behind that?
So SPF, I think most sunscreens nowadays, you don't have to worry too much about which SPF factor to grab. The way that SPF works is that SPF 5 versus SPF 30, there is a fairly significant difference between SPF 5 and 30 in terms of how much sun protection a person is getting. But you don't really find SPF 5 in the shelves very much. Now, the difference between SPF 30 and SPF 60 actually isn't very significant. And the way I explain this to patients is thinking about driving your car on the highway. So if you are going 60 miles an hour versus 100 miles an hour, that's a significant difference. So that might be the difference between going from SPF 5 to SPF 30. Once you get to SPF 30, though, going above that, you're not really going much faster at all. Maybe 1 mile per hour faster. And that's because SPF is on a logarithmic scale. So as long as you're grabbing SPF 30 or higher, you're making a good choice.
Okay, good. Let's change topics here a little bit now, too. With just general skin care, a lot of people are paying large amounts of money for lotions and all sorts of dermatology products to hydrate their skin and look younger. And that might be good. By the same token, one of the best things we could do is just to drink more. Is that right? Most of us probably need to increase our fluid intake, and that's helpful for the skin.
Sure, yeah. You think about, again, the skin's an organ,
Mm-hmm.
just like your heart and your brain. And our bodies, they need to be nourished. So you need to have enough protein and you need to drink enough water. But the skin is the same as any other organ we have. So if you have fairly healthy lifestyle habits in terms of exercising and eating of vegetables and fruits and protein, you're going to have healthier skin.
Okay.
If you don't, if your diet is poor and you don't really eat enough protein or you don't hydrate, just like every other organ, your skin will suffer. Interestingly, though, thinking about the skin as an organ, you can make a certain impact on your skin. So there are studies that looked at weightlifters in particular. Weightlifters, they have thicker skin. So if you are doing something that is promoting growth in your body in a healthy way, you're eating protein, you're sleeping, you're hydrating, and you're exercising, your skin will benefit. But there's not really any particular way to directly target your skin in terms of your lifestyle choices. So when you make really good lifestyle choices, your entire body benefits.
Right.
And
Makes
reverse is
sense.
true
That
as well.
makes sense. Well, of course, the focus of this episode with spring and summer being here is that sun protection factor and sunburn and so forth. But when you look at your website, great website, charlestondermatology.com, there's an A to Z list of all sorts of dermatologic issues you deal with, from acne on through. And what are some of the major things that you see as a dermatologist, people coming in for?
Sure. So acne is one of the most common conditions that we treat. In fact, acne is pretty much the most common disease in the world.
Really?
Yeah.
Wow.
There's really not many populations that you can go to on the planet and not see acne represented in the absolute majority, especially of teenagers.
Interesting.
With one or two few exceptions. So if you go to some of these really, really remote jungles, Borneo in Indonesia, you won't see any acne. And we don't really understand.
I was going to say, why? Huh?
Yeah, we don't really understand why. It's not something that's been terribly studied, unfortunately. But clearly, there are lifestyle modifications that happen in our modern industrial world that aren't happening in these more primitive areas. And there's something that's triggering this very complicated acne cascade. So we don't truly know, but just interesting.
Interesting. All right. So do the majority of your patients come to you because there is a problem? They've noticed a lesion or something abnormal? Or maybe what's the better question is, what is the split between people coming for treatment versus preventive care?
Sure. I think most folks are coming in with probably a specific lesion of concern.
Okay.
But when they come in, they usually want to address that and get a full skin examination is what we call when we do a look at someone's entire skin surface to screen them for skin cancer.
Okay.
So, however, most of the time when people come in and they might identify something new that is concerning to them, usually those end up being nothing to worry about.
Okay.
But we find that subtle little lesion on their back that they didn't even know was there that ends up being a problem. So,
wow.
Yeah.
Interesting. What are the recommendations these days for, say a healthy adult as far as when they should get just preventative treatment or exam, I mean?
Right. I think it is a great idea for pretty much everyone to get a screening exam.
Okay.
Now, when people come in, we can usually triage them in terms of risk. You really can get a sense of who is at a higher risk for skin cancer versus really who's at much lower risk.
Okay.
But it also provides us the ability to educate people about what to look for. If you think about other cancers out there that could cause harm, colon cancer and breast cancer, lung cancer. These are difficult organs to screen.
Sure.
However, your skin, I mean, we can all see it.
Mhm.
And a little bit of education, most patients really can identify these things earlier without even going to the doctor.
So what should we be concerned about if we see some change on our skin? What should be a red alert to reach out to you?
So children
Hmm.
can get new moles. People in their 20s can get new moles. People in their 30s can certainly get new moles. Once you're in your 40s and certainly your 50s and 60s, you don't get new moles anymore.
Oh, really? Okay.
So, yes. And also skin cancer, although young people can get skin cancer, it just is so much more rare than in folks that are in the second half of their life.
Okay.
So if we think about lesions that are new on your skin that you're not familiar with and that grow and change slowly over time. So harmless lesions will show up from time to time, but something that is harmless, or we like to say benign, they typically do not change. Whereas cancer is unregulated cell growth. Cancer will never stop changing. So it's that lesion that slowly changes over time.
Okay.
Even it might be over a year, you might see something slowly change, but that's what we're looking for.
Okay, good. It's a challenge for people. They tell us, hey, I've got to go to the dentist twice a year. I've got to get my annual medical checkup. I've got, for females, whether it's a pap smear or a mammogram or something. Now I've got to add dermatology to that. So you get a screening exam, and assuming that it's relatively benign, should people be re-examined then X number of years later, or what's your recommendation?
No, great question. So there's such variation in terms of people and their risks for skin cancer.
Okay.
That's why coming in to get an initial screening exam, and many times, especially for somebody in their 20s or perhaps 30s, we might say, your risk is really low. Here's what to look for.
Okay.
Call us if you ever notice anything.
Interesting.
And maybe in perhaps 3 years, we might look you over again.
Okay.
That's very different than somebody, say, in their 60s or 70s that has a history of skin cancer, and we're identifying numerous things on their skin that's concerning. We might say, we need to see you every 6 months.
Gotcha.
So just allowing a good dermatologist to screen you and then give you a sense of a good follow-up plan that's tailored to your specific risk.
Okay. So how did dermatology play into that as you look at all these different specialties you could choose from?
Yeah, dermatology, we're not considered the most exciting, especially in terms of trauma surgery or emergency medicine. So it was not on my radar. I was coming out of the Navy after jumping out of airplanes and diving. And
Wow.
so I had thought I was going to pursue something more exciting field that was more intense. But I was sitting through a lecture of she became my mentor, but Dr. Jean Burgess, and she gave us a lecture on dermatology, and it was just fascinating. The number of diseases that manifest in the skin. Dermatology is a rare specialty in terms of we practice medicine, but we also practice pathology, meaning we can look at specimens under the microscope and understand diseases from both a cellular level. And then you also do procedures in terms of surgery. So that combination really intrigued me.
Interesting. That's a great background. Very interesting background how you do that. So wonderful. We're glad you chose that. Well, we're sitting at the Mount Pleasant office of Charleston Dermatology. You got 3 other offices, though, in the region here. Is that right?
We do. We have our Mount Pleasant location, and then we have a location in Berkeley. It's our newest location. And then our first location is in North Charleston, right on the border of Somerville.
I see. Okay, terrific. And this information has been very helpful, even for those listeners who are outside of the metro area here. Thank you for providing this service. Any last words as we're going into the summertime that you'd like to pass on to our listeners and viewers?
So one thing I didn't mention is when you think about children, should children have a skin exam? And that's often a common question from parents. My typical answer to that is that I do think it's a good idea. Children's risk for skin cancer is incredibly low. It happens in much the same way people get struck by lightning. However, when we have that 16-year-old or 17-year-old or even 12-year-old come in for a skin exam, they are used to coming into a dermatology office. They've experienced it. They know what to expect. It's not this significant unknown. So when they are a little bit later in life, if that child becomes an adult and they do see a suspicious lesion, they may have remembered that education that they had years and years ago, and perhaps they're a little bit more likely to seek out that care.
I see. How long is the initial exam, by the way? We didn't ask that earlier. I know it's head to toe, I'm sure, and Fairly long process?
No, not at all.
Okay.
It's very simple.
Okay.
So the whole exam might take anywhere from 10 to 20 minutes, depending on the person and how their level of risk and how complicated their skin is.
It's been fascinating. Well, again, we are at Charleston Dermatology. Dr. Roger Sullivan, thank you so much for joining us here on the Health Links podcast.
Thank you.